I was in construction all my life, so I beat my body up pretty good. And I rolled the ankle real bad and didn't want to take the time off from work, so I wrapped it up, put it in a work boot, laced it up tight, and went back to work. Then my wife's car got stolen, and the kid dragged me across the parking lot with it. And I got off of the car at about 40, and I blew the disc in my neck, both shoulders, and wiped the ankle again. And that finished the ankle. So for 15 years, I laced that boot up as tight as I could lace it and walked on it.
When John came to my office, he's been dealing with his condition of the cartilage injury and the underlying bone being dead for 15 years now, and he's seen multiple doctors and all tell him the same thing. You're going to get a fusion, you're going to get a replacement, you're going to be off of your foot for 6 months.
I went to see Dr. Lai, and he walked in, he said, "Okay, tell me what's going on." And I explained the whole thing to him with about being on crutches for 6 months and then another 6 months. And he said, "No, that's all old school."
With John, his procedure, which they talked about fusion, taking bone graft, we do that minimally invasive, one of the newest procedures out there, where we're actually replacing and healing that underlying cartilage and the bone underlying there, all through a small incision, quicker recovery without any of the postoperative pain or rehab. And he did really well. And that also is a newer technology down here in South Jersey.
I was 5 weeks on the crutches. I was out of the boot in about 14 weeks, I think. And tomorrow will be 22 weeks since the surgery. And I can walk, shoes, sneakers, anything I want, anywhere I want to go, run, jump.
Shore Medical Center has a great facility. They have state-of-the-art operating room, as well as with how advanced all of their instrumentation is same goes for the staff there. They're high quality staff, most professional, but also compassionate. And they make operating there smooth as possible, allowing me to do some of the more high-tech and more up-to-the-date procedures there.
You walk in, they sit you in a chair, they push you back to the room to get you set up. Everybody's in there, you're all set up. Next thing you know, you're back out in the recovery room. And it was great. He gave me what feels like a brand new ankle, so as long as I got a brand new ankle, I'll keep going.